Hi all, Mr. Midwife here. So, disclaimer, this video is not to be taken as medical advice. It's strictly my opinions and my experiences. So I'd like to talk to you about a subject that's dear and almost painful to my heart. I was on live stream with Nurse Liz yesterday, and this came up. And anyway, on the outset, I would like to invite and ask for any comments by any other midwives, OBGYNs, or other obstetrical providers, anybody that provides obstetrical and labor and delivery services. Please, I invite your comments and your thoughts. Anyway, so as a midwife, I am involved in people's most intimate parts of their lives. I'm there during the prenatal period, all the way through the labor and delivery and the childbirth period. And moms, the dads, grandmas, brothers and sisters, I get to be involved in the happiest times of their lives, and sometimes the saddest. So a couple of weeks ago, I had a lady come in with her significant other. I've been taking care of her for several months, and in a normal obstetrical visit, we do measurements and chit chat and any concerns and how you feeling, and then we get heart tones. And this lady was about 38 weeks, so she was full term. She could have been delivered. And as I went to get the heart tones, I searched for minutes and minutes, and all I heard was the deafening silence. My heart sank to my feet. The blood drained from my face. Fortunately, we have ultrasonographers in our office, and I said, I excused myself from the room. When I went down, I grabbed one of the ultrasonographers. I said, I need you just for 1 minute. I just need 1 minute. I just need to verify this baby's still there. And she agreed. And I came back, got my patient and her significant other, and we raced down to the ultrasound room. And within a matter of about 30 seconds, we could see there was no heartbeat. And I can tell you, as a provider, that's one of the worst days of my life. It is not easy for me to tell somebody that. And so as a provider, and this is the part that really stinks, as a provider, I have to muster up the courage to let my nerves turn to steel and ice run through my veins for only 30 seconds as I look at my patient and her significant other, and I say as coldly as I can, because it's all I can do, there is no heartbeat. Your baby is dead. And after that moment, they cry, and I cry, and Dad cries, and the ultrasound tech cries. And those are the worst times of my life. We got her up to labor and delivery later that day and got her delivered and discovered the cause of it all. But I want you to know, as a midwife, as a provider, and I'm sure any obstetrician, gynecologist, any other midwife on this planet would tell you the same thing. I can't tell you that I feel as badly as you do, but I can tell you it's devastating to me. I cry too. Anyway, so for all of you parents out there, moms and dads, who have had to suffer this awful fate, whether you're 5 weeks along or 40 weeks along, it doesn't matter. A loss is still a loss. My heart aches for you, and I'm sorry for you. And to my patients who I've had to suffer with over 20 years of doing these things and having discovered some of them over the last 20 years or so and been involved in it, I'm sorry for you. My heart aches for you. I cannot tell you that in time you will be healed. I cannot tell you that the hurt will go away. But hopefully you'll be able to breathe again someday. Anyway, again, I invite comments from all of the community, for many of you who've suffered a loss, for any gynecologist, obstetrician, midwife, or anybody else who attends deliveries who have had to hold your patient's hand as they go through this. I invite your comments. Anyway, thanks, and we'll see you in the chats.